Hello, everyone. This presentation is part of the Technical Assistance for Brownfields program and will focus on cancer-related health data. My name is Sarah Wakai, and I'm an assistant professor at UConn Health Center for Population Health. I'd like to also acknowledge the leadership of the Technical Assistance of Brownfields program for Region 1. The learning objectives for this presentation are define cancer and associated terms, review potential risk factors of cancer with a focus on environmental exposure, explore data sources that monitor cancer health risk with a focus on TAB Region 1 states. Let's start out by reviewing some general background information and terminology related to cancer. Cancer refers to a large number of diseases in which abnormal cells multiply uncontrollably, spread to other parts of the body, and destroy normal body tissue. As you conduct a data search for your state, you will see that many of the cancer data sites have an option to search by type of cancer. Keep in mind that cancer can develop anywhere in the body and is named for the part of the body where it started. For instance, breast cancer is still referred to as breast cancer, even if it spreads or metastasizes to other parts of the body. Some cancer data sites include different stages of cancer, ranging from stage 0, where abnormal cells haven't spread beyond where they started, also referred to as precancerous cells, high-grade dysplasia, or carcinoma in situ. Stage 4 cancer has spread beyond the original site to other organs or distant areas of the body, also called metastatic cancer. This map provides an overview of incidence rates in the state for all cancers, all races, and both genders. As you can see, Connecticut and Maine, which are states in TAB Region 1, are darker blue, indicating higher incidence rates. You can roll over a state to see details and click on a state to get even more details at the county level and by state level demographics. Recently, the American Cancer Society released their annual cancer statistics report for 2025. The report ranks the types of cancer with the highest incidence and mortality. Just to review some terminology that you will see when investigating data sources. Rates are calculations. In cancer research, rates are based on the number of cases per 100,000 people. Incidence refers to new cases. Prevalence represents new and pre-existing cases. Mortality refers to deaths. Here you can see breast cancer, prostate cancer, and lung cancer have the highest incidence and mortality rates. Cancer incidence and mortality rates have declined over the last several decades, primarily due to smoking reduction, early detection of some cancers, and improved treatment. Overall, cancer incidence has declined for men, but has risen for women. When looking at the incidence rates by age and sex, you will see that rates for older men have declined, while rates for younger women have increased. Health disparities continue to exist. Native Americans and Alaska Natives have higher cancer incidence rates than other races and ethnicities. Native Americans and Alaska Natives and African Americans have higher cancer mortality rates than other races and ethnicities. To give you some context on the leading causes of death over the past several decades, here is an animated graph. Cancer deaths peaked in the mid-90s, and although it continues to be a devastating disease, it has since decreased. And if you click on this link here, it'll take you to the site where you can see it in the animated version. Another way to look at the leading causes of death is by examining the data by age group. CDC manages Whiskers, which is the web-based injury statistic querying reporting system. At this site, you can select national, regional, or state level data and highlight a specific disease. Here you can see a table of northeastern states, which illustrates higher death rates of malignant neoplasm for older adults. It is not always possible to know why one person develops cancer while another person doesn't. Research suggests that certain risk factors may increase a person's chances of developing certain cancers. A greater frequency, quantity, and duration of exposure to a specific risk factor may lead to an increased likelihood of developing a cancer. Exposure to multiple risk factors over time may also increase the occurrence of cancer. Some risk factors may be avoidable, such as smoking tobacco, but others, for example, simply aging or certain environmental exposures may not be. Also, certain risk factors like sunlight, which is linked to skin cancer, also has some health benefits, such as vitamin D production, mood improvement, and circadian rhythm regulation. Since it's not recommended to completely eliminate sun exposure, there are ways to safeguard oneself by using sunscreen and limiting sun exposure during high peak hours. The World Health Organization suggests protective factors that may reduce one's chances of developing cancer, including not using tobacco, having a healthy diet, being active, and preventing infections that may cause cancer. The NIH National Cancer Institute, also referred to as NCI, has created a list of the most studied, known, or suspected risk factors for cancer. So since this webinar focuses on brownfields, let's take a closer look at cancer-causing substances. So if you click on this link, and let me share a different screen. So here you'll see a list of substances. And if you click on one, say, for example, asbestos, since asbestos is often found in brownfields, you'll be sent to a website that provides details. Here you have a definition of asbestos, exposure routes, cancers that are associated with exposure to asbestos, in this case, mesothelioma, lung, larynx, and ovary cancers. And then they also provide some references if you wanted to look at information for a little bit more background information and more details. Okay. All right. Now, how do these substances make it to this list? There are two organizations, the National Toxicity Program, which is under the U.S. Department of Health and Human Services, and the International Agency for Research on Cancer, which is the cancer agency of the World Health Organization. These organizations have developed lists of substances known or are reasonably anticipated to be human carcinogens based on available scientific evidence. Specifically, the NTP publishes the Report on Carcinogens. The 2021 edition lists 63 known human carcinogens. And here's a link to the report. It also has a dashboard where you can search for a substance type and cancer type. The National Cancer Institute Surveillance, Epidemiology, and End Results Program, also known as SEERS, offers a valuable website with searchable functions and fact sheets. Rates and trends are available for gender, race, and age for numerous cancers at the national level. So if you want, I can take you to that website. And so this is what SEERS does. You can compare recent trends. You can look at recent rates, and you can select ethnicities and specific types of, there's long-term trends and age too. So it's a pretty valuable resource there. Okay. Right, so now let's take a look at the link between proximity of brownfield sites and cancer. In a study by Litt et al., the researchers investigated brownfield site locations in Southeast Baltimore and the health and well-being of residents living near these properties. The researchers examined data at the census tract level and found that residents 45 years and older living in areas deemed the highest brownfield zones experienced statistically higher mortality rates due to cancer in general, lung cancer specifically, respiratory disease, and other major causes of death than residents living in low brownfield zones. This table highlights cancer data sources for each of the tab Region 1 states, and I can walk you through each of these states. Okay, so this is Connecticut's website, and you can look at this information by graphs or by maps. There's county filters, and let's see this. If we get smaller, you can kind of see where yellow represents. Let's make this so that you can see it. So the yellow represents significantly higher rates than state averages. Blue represents significantly lower rates than state averages. And then you can scroll over the map to see certain town data by towns. And you can also enlarge tables if you want to, like this here, you can enlarge that if you'd like. And you can select bar graph options and select indicators such as sex and cancer type. The downside of this map is that the data is over 10 years old. We can also look at what Massachusetts had. So this website offers maps and tables. Let's see if we can. Yep. So here, this is after you've clicked on direct incidence rates, all ages, both sexes, county level geography, and you can select a town, for example, Worcester, and cancer types such as lung cancer. And for the most recent time period, which is 2012 to 2016, and you can review the data as a map, table, or chart. And although this is very valuable data, it is still a little on the older side. And you can also export data. Okay, and let's move on to Maine. Maine offers an extensive report which provides cancer incidence rates by county using 2019 and 2021 data, and cancer mortality rates by county using 2017 to 2021 data. So this is a pretty nice and comprehensive report that you can kind of scroll through to see what you need. And New Hampshire has a data portal where you can search for cancer types. For example, lung cancer incidence rates. Here you can see data at the county level. The map shows that Stafford has higher lung cancer incidence rates than other counties in the state. You can also see trends over the last 20 years, rates by age group and stages of cancer at diagnosis. And Rhode Island offers data reports, some of which are by cancer type and fairly recent. And then let's see, this is Vermont. And so it will list it lists areas, observed cases, expected cases, and whether or not they're different from the state. You can apply different data filters. Okay, and that summarizes an overview of cancer data, public health cancer data that you can use when you're creating your report or just want to understand what is going on in your community.